I'm gonna go ahead and stop my video just so the internet and Wi-Fi links just to my voice. We've come to find out that that works a little bit better if the video is not on. So can everyone hear me okay? Yeah, perfect. All right. So welcome. Thank you for giving me your time today to learn something very important. We're going to talk about what to do in case of an emergency. And my name is Andrea Watkins, and I am the program supervisor for the Women's Fund. The program team has been working really hard all summer trying to make these new presentations for you. So any feedback that you have, we would really appreciate. I went ahead and I put the survey link on our chat just because I know at the end I'm trying to hurry and wrap things up. So just click that link and it should take you there. The survey shouldn't take more than just a minute. All right, so before I get started with the actual content, I'm gonna go ahead and talk a little bit about the Women's Fund. For those of you who are new to these presentations, welcome. And for those of you that have been tuning in, thank you again. We'd love to see familiar faces and little screen names that we've come to become friends with. So what the Women's Fund does, we do focus seminars, we do curriculum-based classes, and then we do publications, all free of charge to the women and girls of the greater Houston area. We do all of this free of charge because we believe that it is important to get health information out there, the right health information out there, just to make sure that you are better equipped with the knowledge of what to do when it comes to your health. So you can follow us on our social platforms. We have Instagram, Facebook, Twitter. That will be the best way for you to keep up to date with what's going on, more presentations that are coming up, anything that we have going on, you can follow us on there and you'll be up to date. All right, so before I get started, I just want to give you a rundown of what we're going to talk about. It is fairly content heavy. So if at any moment you have a question, please feel free to put it in the chat. I will answer all questions at the end. This particular presentation is very, like I said earlier, content heavy. So again, if you have any questions, I would love to just stop and pause, or if I said something, or if you need me to repeat what I said, I would be more than happy to. So we're going to talk about health emergencies. We're going to talk about climate and home emergencies. We're going to talk about how to do basic first aid. And then we're going to review and close and why all of this is important for your health. So my goal when you are done with this presentation is to make sure that you are able to discuss potential health emergencies and state measures for handling them. My goal is to make sure that you can state safety components for preparing a home for inclement weather. We all know that we're in hurricane season and we've been scarred by Hurricane Harvey. So what is it that we can do to better prepare? My goal is for you to also list recommended practices for creating a safer home for your family, and then how to identify important emergency techniques to help someone in immediate need. Now, some of the things that I will be talking about are very basic. There are courses that you can take to be certified in some of these things, like CPR training, but I will do like a very basic overview. If you have any other questions, I would be happy to refer you to someone that can give you an actual CPR course where you're certified and trained, because again, what I'm saying is just super basic. All right, so we're gonna start off with some basic vocabulary. Some of these words we get thrown out a lot, but I would like us to know the proper definitions to them. So when it comes to first aid, it is the immediate care that you give a person with an illness or injury before rescuers with more advanced training arrive and take over. So there is a thing called the Good Samaritan law, that if you see someone in distress, that if you go over there and help them, they cannot turn around and sue you because they ended up more hurt, or they ended up hopefully not dying. But a Good Samaritan law protects you to go help someone that is in need. So don't be afraid to go help someone if they're stranded in the middle of the road, or if you feel like they need some immediate attention. Okay, so responsive versus unresponsive is, responsive is someone who is responsive that will speak, blink, move, or react if you ask them if they're okay. That's what responsive means. Now, unresponsive means someone who does not do any of those things and does not say that they're okay. And then we have agonal gasps, which it frequently presents in the first minutes after sudden cardiac arrest. Now, these gasps, I'll talk a little bit more about in a second, but they happen and you think that, okay, maybe they are breathing or maybe they are responsive. This, like I said, I will go more into detail about it in just a moment. And then again, CPR is when a person's heart stops suddenly. You providing CPR can help this person. It can even triple the chances of survival. So it is made up of 2 skills. It's providing compressions and giving breaths. Now, again, this is very basic what I'm going to talk about, but you can always learn more. A lot of the content that I grabbed was from the American Heart Association. So if you go to their website, they can help you actually take that course or help you navigate where you can find someone to give you that course. All right, so I'm going to start off with medical emergencies. So a stroke is something that it's a medical emergency in which you need your first aid skills. So it's when blood stops flowing to a part of your brain. Now this can happen if a blood vessel in the brain is blocked or if it leaks. So many people can be given treatments in the first hours after a stroke that can reduce the damage and improve recovery. Therefore, it's important to recognize the signs of stroke quickly and get immediate medical care. Now, some of the slides that I have here, my colleague Kayla talked about when it came to heart health. So when it comes to a stroke, these are some of the warning signs. So maybe you have sudden weakness on one side or numbness. You know, sometimes our arms do fall asleep, but this is just sudden and it came out of nowhere. Then you may also notice that you have sudden dimness or loss of vision. You also can have loss of speech, trouble talking, difficulty understanding speech. Then you can have a sudden severe headache with no known causes. Sometimes we do get headaches for no reason, but if it's in conjunction with all of these signs, then maybe that's a sign for you to act quickly. And then again, if you have dizziness, unsteadiness, or sudden falls. Now, when it comes to a stroke, learning this acronym FAST is really important. So again, I know that I went over some of those warning signs, but if you can remember FAST, then that's wonderful. So FAST, the F stands for your face drooping. You know, if the person smiles and one side droops, then that you can tell that the face is kind of drooping to one side. Also, arm weakness. Ask the person to raise both arms, either in front of them or like a T. And if one arm starts to drift downwards, that's another sign. Speech difficulty. Ask the person to repeat a simple sentence. And are their words slurred? And then 911. You always want to see the time. If the person shows any of these signs, you need to call 911 immediately and then note the time, because it's just a matter, the faster that we can help someone, the better chance of recovery they have. So again, if these symptoms last more than 5 minutes, call 911. Do not drive yourself into the emergency room. You might think that you're okay at the time, but you don't know what it's going to be like once you're on the road. So please do not drive yourself to the emergency room. And then contact your doctor, even if symptoms do not last more than 5 minutes. You have to tell your primary care physician that something happened that you think you might have gone through a stroke. All right, so now we're going to shift gears to heart attack. So I do want to clarify here before we start talking about a heart attack is that people often, they confuse the term sudden cardiac arrest and heart attack. They do not mean the same thing. So Heart disease is actually the leading cause of death in the world. If someone has signs of a possible heart attack, you must act and phone 911 right away, even if the person doesn't want you to. So sudden cardiac arrest is a rhythm problem. So it occurs when the heart malfunctions and it stops beating unexpectedly. So it just stops. A heart attack is a clot problem. So it's whenever a clot doesn't allow the blood to flow as it usually does. So it blocks that blood flow. So again, those are two different things, but either way, the first minutes of a heart attack are the most important again. So that's when a person is likely to get worse or even die. Also, many of the treatments for heart attack will be most successful if they are given quickly. So these are warning signs of a heart attack. Uncomfortable pain or center of your chest. You might feel like there's just pressure on your chest, like someone's stepping on it, almost like something really heavy. You might have pain in one of or both of your arms, and then in your back, neck, and jaw. You might have shortness of breath without really doing something to really make yourself, you may exhaust yourself. You may have not exhausted yourself, but you still have shortness of breath. You may break out in a cold sweat. You might be nauseous. You might be lightheaded, dizziness, and fatigue. Now, again, I know that we all go through some of these sometimes. Maybe all of a sudden you're just nauseous, you don't know why, or you have a headache and you don't know why. I want to stress that it's the conjunction of all of these that would be warning signs of a heart attack. So if one day you're just fatigued, don't think you're about to have a heart attack. It has to be all of these things combined. And also, I do want to point out that some of these go hand in hand with the stroke warning signs. So it's very important for you to make sure that you know what the signs are. If you have family members that you live with or that you visit frequently, it's good to know these things. If you have a history of heart attacks in your family or strokes, it's important, again, to know some of these signs and symptoms so you can get them help right away. So let's say that you think you've had a heart attack. Again, sometimes we tell ourselves things that don't exist. We bring things into existence by saying, oh my gosh, I have a headache. Does that mean I have a heart attack? So let's say that you think that you've had one. Don't ignore it. Again, it's a combination of all those things. If you have 3 or more of the warning signs that I showed previously, don't ignore it. Call 911 for help, call 911, even if you are unsure. It's so much better to be safer than sorry. Acting fast, again, can save your life. So the faster we respond, the better. And then every minute matters, don't delay. All right, so I'm gonna move on to the next medical emergency, choking. So choking is when food or another object gets stuck in the airway in the throat. The object can block the airway and stop air from getting to the lungs. So what I do want to also clear up is the difference between a mild airway block and a severe airway block. So it might look like someone is choking, like, maybe sometimes water goes down the wrong pipe, or maybe you swallowed your own saliva really fast and you get that choke. That's not choking, because you're still able to breathe and you can still talk or make sounds and cough loudly. So that's not choking. It's just something that went down the wrong pipe. Now, you do want to stand by that person and make sure they're okay. But sometimes the person, the last time you swallowed water wrong, you do have to cough it up. But again, that is not choking. A severe airway block is when someone cannot breathe, they cannot talk, or they cannot make any sounds. They have a cough, but that it has no sound, and that they make the choking sign, the universal choking sign. At that point, you have to act quickly and then follow the steps to help an adult, child, and infant with a severe airway block. All right, so what do you do when someone is choking? I know it can be scary. I don't know if any of you have ever been around it. I know I've seen it at restaurants. And it does get scary, and you don't want to be that person that's just standing there while no one else knows what to do. So what do? If you think someone is choking, ask them, are you choking? Can I help you? You also, if the person nods yes, then tell them you are going to help them. Stand firmly or kneel behind the person, depending on your size and the size of the person choking. And then wrap your arms around the person's waist so that your fists are in the front. And then you want to make a fist with one of those hands. Put the thumb side of your fist slightly above the belly button and then below the breastbone, so right in between those two. Grasp the fist with your other hand and quickly upward thrust into the abdomen. Give thrust until the object is forced out and the person can breathe, cough, or speak, or until they become responsive. So the Heimlich is pretty much what you're doing. So the picture up here, this is the universal choking sign, right? So if you see someone doing this, or if you think you're choking, this is the sign that you want to make so that someone knows to come to assist you. And then right here is where you're going to place your hands and do the movements. It's right underneath the breastbone and right above the belly button. Now, if you can't take, if it's not working, then you do have to go ahead and administer CPR if the object did not become, if it did not come out. Now, let's say the person's larger. So you want to come right there by their breasts, right? Like by where their xiphoid process is. Right in the middle of their breast, you want to do the motion of like, it's almost like scooping something up with your thumb. Now, when it comes to a baby or an infant, you want to place them on their back. With one hand, you hold their chest, and then with the other hand, you're just kind of patting them on the back to get it out. Now, if that doesn't work, you do want to flip them over and do kind of the same maneuver, but with one or two fingers, depending on the size of the baby. Now, again, if that object does not come out, then you have to administer CPR. Now, with a child, I know it's very scary. You want to act immediately. Again, if you can hear the baby, then that's a good sign. There's something in their throat. But if they're like gasping without sound or they're coughing without sound, it's the quicker you act on getting doing this sequence, the better. Now, I also asked, or someone asked me while I was doing this presentation, how do you do it when you're choking by yourself and there's no one around? So if you're by yourself at home and you're choking, the best thing that you want to do is get behind a chair or maybe behind the sofa, something that you can run into. Maybe I've also heard of a counter where you can go and you can lunge yourself into something heavy that can help that item come out. All right. So remember, if they're unresponsive and there's no breathing and only gasping, then you have to go ahead and provide CPR. If you doing that Heimlich did not work, then it's time to move on and provide CPR. Now, CPR, I know, again, in times of emergencies, you get very flustered and you don't know what to do, but it's very important to remember steps so you can save this person's life. So once you've tried to administer the Heimlich and it does not work, you want to put the person on the ground, make sure they're lying flat on a firm, flat surface. Don't make the mistake of lying them on a bed because that's not firm enough. You want to make sure it's like on the ground. You do want to remove their clothes out of the way because, you know, if there's a button or if there's something, it could either come in contact with how you're administering the CPR, or it just might be very uncomfortable for you. Now, I know you being uncomfortable is not a big deal, but we do want to make sure that we can access CPR the best way possible for the person that's choking. So a good rule of thumb is you give 30 chest compressions and then 2 breaths. Now, chest compressions, they feel uncomfortable. You feel like you're really hurting the person, but honestly, you're really not doing anything to them. If anything, you're helping them get that air. So it does get exhausting. giving 30 chest compressions. There is a certain rhythm that you have to follow when it comes to giving these. You put the heel of one hand on the center of the chest, and then you put the other hand on top. And then it says to push straight down at least 2 inches. Of course, you're not gonna really know or go and measure what 2 inches is, but you wanna make sure you're pressing very firmly, okay? Again, you might end up like hurting or bruising something like their xiphoid process, but in the long run, you're saving their lives. So after you give those chest compressions, you also wanna give 2 breaths. You wanna open the airway, so you wanna open their mouth and you wanna see if there's something in there. That if you see something in there, go ahead and sweep it out. But if you don't see something, go ahead and administer the breaths. And it's by tilting the head and lifting the chin. And then you wanna blow for 1 second. You will actually see the chest rise every time you give a breath. So that's how you know that you're doing it strong enough. I'm gonna talk about the AED in a moment, because I know that if it's a stranger that's choking, you probably don't wanna give a mouth to mouth, but if there's a first aid kit or an AED device around, you can put a barrier between your mouths. So with the child, the only difference with the child is that you can use either 1 hand or 2 hands depending on their size. So again, with an adult, you use 2 hands, but if the child is smaller, you can use 1 hand by putting the heel of that 1 hand on the center of the chest, on the lower half of the breastbone, and then using your arm pressure like that. All right. So here is how it would look like. You see the rhythm that the person is doing right here. Now I know this is a dummy and our bones and skin wouldn't move like that, but that is how deep you wanna make sure you're giving these compressions. Do not be afraid to hurt this person. So right here, if you have a 2-man team, you wanna give the 30 compressions, and then when you're done, the other person does the breaths, and then switch, because giving the compressions is actually extremely tiring. You do run out of breath. So switching, if you have 2 people, is great. Now, the AED is that device that I was saying about earlier. So an AED is, you can find these in a common area within a building. So like maybe the lobby, maybe a gym, somewhere where you can easily access it that everyone can see. So what AED stands for, it's an automated external defibrillator. It's a lightweight portable device that can detect an abnormal cardiac rhythm requiring treatment with a shock. So the AED can deliver a shock to convert the rhythm back to normal. So again, if there's 2 people, you want to go ahead, 1 person goes and tries to retrieve the AED while you go get help. While that person is running to get the AED, you want to call 911 and you start the chest compressions. Again, if it's just you by yourself trying to help this person, then I would go ahead and just do the administer the CPR. And so the AED, as soon as you open it, it walks you through it. So it could be yellow, it's like a lime green. Next time that you're in your office building or maybe your apartment complex, make sure that you spot those out, because anyone in the building can go through something like this, and the faster you know how to get to it, the better. The AED is super user-friendly. The moment you open it, it walks you step by step on where to place those pads, what button to press, and what to do. So don't be afraid. All right, now we're gonna shift gears into allergies and allergic reactions. So these are very common. I fortunately have not seen this happen to myself or anyone around me, but I know for those that have seen it or someone that does not know that they're allergic to someone, it can be quite scary and it can turn into a medical emergency almost immediately. So some of the things that can cause severe reactions are eggs, peanuts, chocolate. There are some medications, and then there's some insects, bites, and stings, especially bee stings. So some of us know that we're allergic to this stuff already, but against maybe with a child that they haven't eaten some of this stuff before, maybe they haven't taken this medication before, you find out really quickly. So the difference between a mild and a severe allergic reaction is a mild is just kind of a stuffy nose. You have some sneezing and some itching around the eyes. If it's a bite, you have the itching around the skin and it's raised. It's kind of red, kind of like when a mosquito bites you. It's a mild allergic reaction. Now, I have met and seen that some people are extremely allergic to mosquitoes and bug bites. So for those reasons, you might want to have Benadryl right away or have insect repellent, or maybe just don't even go outside, especially in Houston with all those mosquitoes. And then a severe allergic reaction, you can have trouble breathing, a swelling of the tongue and face. I don't know why it says FOSS, I'm so sorry, it meant to say face. And then signs of shock. All right, so I don't know if any of you have seen an EpiPen. Epinephrine pen is what helps someone going through an allergic reaction. So again, these, if the person has high allergies, they probably have this on them. A medical emergency person will always have EpiPens on them. So this is a drug that can stop that severe allergic reaction. It is available by prescription, like again, to those who have high allergies, in a self-injectable pen device, and it's called the epinephrine pen. So if you know that you have severe allergic reactions, it might be a good idea to carry these on you. Again, the instructions are on the pen. There have been times I have heard that people accidentally stick the needle end on their fingers instead of their thigh. You always want to stick it straight into the thigh. And it gives you instructions exactly on how to do it. You just pull out that blue safety release, and then you will see the needle end, and you just put it on the side of your leg and hold it there for about 10 seconds to deliver the drug. You can also rub it in for a little bit, but again, there are instructions on it. If you see someone having a severe allergic reaction, they might just give it to you and you can just administer it if they don't administer it to them themselves. All right. And then there actually are two types of epinephrine pens. There's a spring activated one and there's an electronic one. And there's also different ones for children and adults. So be sure that you always get the correct prescribed device. If the person has an EpiPen, then they will generally know how and when to use it. So you may be, it might happen at work. Again, if you have that EpiPen, you might always want to tell your coworkers, like, hey, in case this happens, or in your family, if, sometimes we cook things and we don't know that it's in there, or we eat things, make sure that if you are prone to severe allergic reactions, that you have this on you and you share with your loved ones how to use it. Okay, so we're gonna move on to seizure. A seizure is an abnormal electrical activity in the brain. So most seizures stop within a few minutes, and they're often caused by a medical condition called epilepsy. These seizures can also be caused by a head injury, low blood sugar, heat-related injury, poisoning, or sudden cardiac arrest. So before I move on to the next slide, typically what you want to do is when you see someone have a seizure, you want to make sure, again, that you lie them on their back and that you roll them over to their side. Heard before that people try to put things in their mouth so that they don't bite themselves, but then the person that attempts to put that in their mouth ends up hurting themselves because their jaw gets locked. So don't try to put anything in someone's mouth. I mean, they will end up biting something, but it's better than you getting severely hurt. So you just want to lie them by their sides, and usually it's very quick process that happens. And again, someone who has epilepsy will generally let you know, or they can feel it. Some of them have service animals that help them. So make sure that you communicate with your friends and your loved ones, like what to do when that happens, or how to get help. All right, so I'm gonna switch gears. I know I have 15 minutes left, so I'm going to really try to hurry. I'm going to switch gears to environmental safety. So fire safety, just what I would say is make sure that you always know a way out. You know, picture your house, picture your office or your job environment. You can even picture somewhere where you find yourself a lot. Maybe you go over to your sisters a lot, or maybe you go over to your parents. Make sure that everyone has a clear understanding of 2 exits of how to get out of every room. It's great to do it with the family. You just draw up your house and say, all right, if this were to happen, how would we get out? So you want to develop this plan with your family and actually practice it. Practicing makes perfect, so that when this does occur, you guys are better equipped on how to get out. And once you leave a fire, stay out. You always want to call 911. You want to wait for others and never return inside a home and building that is on fire. If your phone's there, leave your phone. Purse, there's no item that is worth your life for you to go back into a burning building. So you want to make sure that you come up with a meeting place that everyone knows, like, hey, let's meet at that tree by the neighbors, or let's meet over here by, you know, the mailbox, this person's mailbox. You always want to have a meeting place. And if you can, of course, try to help on the way out, but don't go back into the building if it's on fire. Cannot stress that enough. So mostly every building, or most every building, should have a fire extinguisher. They don't all look like this. I believe that it is against the law to not have one in your home. Now, again, you might have one in your home and it doesn't look like this. It might look a little bit different. Not every fire extinguisher looks the same, but when you see this one, how to use it when there is a fire, you always want to remember pass. You want to pull the pin, aim, squeeze, and sweep underneath the fire. Again, the instructions are on there, and I will give you a copy of this because I know it's a lot of information for you to remember, but you want to make sure that you know how to properly use this in case of a fire, even if it's a small kitchen fire. Also, you want to check the expiration date on these because these do expire, and you can have someone come out and look and see if it's up to date and replace it. So sometimes you'll have fire marshals go to buildings to make sure that their fire extinguisher is not expired. Alrighty. So again, the obvious, you want to make sure that there's smoke detectors in your home. These can decrease the risk of dying by 50%. You want to make sure it works. You want to change the batteries often. You also want to install carbon monoxide detectors. The scary part about carbon monoxide is that it's odorless, tasteless, and colorless. So you have no idea. You want to make sure it's outside of every sleep area. And when it comes to changing the batteries, you could do something like every year on your birthday, you change the batteries, or every daylight savings or spring forward, you want to change the batteries. Something that will help you remember that the batteries have to be changed in order for them to work efficiently. All right, so we're going to move on to flooding. So these are the differences when you see all the newscasters saying, oh, we're going through a flood warning or we're going through a flood watch. So what this means is that when there is a flash flood warning, it is issued when a flash flood is imminent or occurring. If you are in a flood-prone area, you want to move immediately to higher ground. A flash flood is a sudden, violent flood that can take minutes to hours to develop. And it is even possible to experience a flash flood in areas not immediately receiving rain. So I know that we've been through a harsh hurricane season about, I want to say it was 2 years ago, 3 years ago, with Harvey. And we came together as a community and we did prosper through it, but we also learned a lot. You know, the campaign, Turn Around, Don't Drown. If you can't see, you know, the road and it just looks like a lake or river, please do not attempt to go in, especially if you have a lower to the ground car. Or sometimes we think we have the proper SUV and then we attempt to do it and then you get stuck. That is, you don't want to be stuck in the middle of water and then just watch your car just get completely flooded out. But I know that Houston is a little bit more equipped on how to handle floods, but even if maybe you just moved here to this area, flooding is very prevalent. You probably know your neighborhood better than everyone else. You know that maybe there is a certain pocket of neighborhoods around you that flood, but maybe you don't. But what's also really awesome is that our technology that we have, our phones, they let us know when there's an emergency alert. And the news is pretty good about predicting, hey, this is about to happen. This is probably where you should go, or this is what you should probably do. Now, assemble an emergency kit. Now, I know that COVID we've really seen how people act in times of emergencies when it comes to toilet paper and antibacterial wipes. So whenever you see this, it's a good practice just to assemble it, even if you're not in hurricane season, or even if you assemble it a year or two ago, at least it's prepared and your family has access to it. So you want to make sure that you have enough food, water, and medicine on hand at all times to last you at least 3 days, because we know that with hurricanes, the power can go off. You can't leave anywhere, you're stranded. So make sure that you have all of that on hand. You want to make sure that you have enough water for cooking, and maybe there's no refrigerator, there's no power. So you want to make sure that you have enough water to last you for those things. You should also have batteries, blankets, flashlights, and a first aid kit, maybe some rubber gloves and boots, and then a radio or battery operated radio to help you try to navigate what's going on outside. Preparing your home. Again, I don't want to go all of these word for word. I'm going to send you this presentation for you to look at it, but you want to make sure that your home is prepared. Again, we are in hurricane season, so flooding tends to come with it. So make sure that you start looking into homeowners insurance if you don't already have it, so that your house is secure through that flood insurance. You want to make sure that your home, your family knows what to do whenever floods do start to happen. Like I mentioned, flooding comes from hurricanes and tornadoes. Now, we might not get a lot of tornadoes in the Houston area, but that is what a hurricane is. It's just a tornado with a bunch of water. It brings a lot of water. So again, we're very fortunate that we have very good technology and newscasters to let us know what's happening. They can usually track this stuff well in advance for us to prepare. Again, it is not a bad idea to already have these kits with you, because if the storm gets closer, we know what we do when we panic. We run to HEB and everything is sold out. So if you already have it, then that's wonderful. You're one step ahead of the game. Just don't wait until you have a hurricane heading your way tomorrow and you're going out to the store to stock up. So here is kind of like a key to let you know how severe it is. Again, they do a really good job at tracking at where it's going to go, and sometimes it does end up going somewhere else. But for the most part, you always want to make sure to err on the side of caution. Again, here's your hurricane emergency kit. It's just an extreme weather kit. It's good to have these things. Just prepare for the emergency plan and make sure that your family knows how to use it. Make sure that your family knows that maybe that water is not meant for consumption right now. We're saving that for an emergency. So just make sure that you have that thorough communication with your family, because you're trying to prepare in case something happens. All right, so now I'm gonna shift gears a little bit back to medical and talk about first aid kits and PPE. Now, I know we've heard the phrase PPE a lot in the past several months due to COVID. So we're kind of very familiar of what it is, but maybe you don't know what exactly should be in a first aid kit. So here is what should consist, or what should be in a first aid kit. It should have small and large sterile gauze pads. It should have adhesive Band-Aids or bandages, It should have gauze roller bandages, triangular bandages, a wound cleaner. You want to have scissors. I can be pointing at them as I'm talking. Scissors. You want to make sure you have a blanket in case someone's in shock. I don't see the blanket here, but this is the roller bandages, the normal bandages. You want to have Neosporin for cuts and stuff. It's a good idea to have several types of Band-Aids because it could be a bigger wound or a smaller cut. Gloves, you always want to have those. Again, an ice pack. Again, tape, adhesive tape for you to properly bandage or dress something. Latex gloves, resuscitation equipment. I'm sorry, I couldn't spit that word out. Elastic wraps, a splint, and directions for obtaining emergency assistance. So usually when you buy a first aid kit, like this one from Johnson & Johnson, it has what to do in case of an emergency. It's like a little how-to book, a little pamphlet. If you have built your own first aid kit from scratch, that's perfectly okay. Just make sure that your family knows where it is and how to access it. And then you can print out things on how to handle emergencies and then just stick it in your first aid kit so it can help you at the time of need. And then again, PPE is a disposable hood for your hair. It's a disposable gown. It's a 3-ply mouth mask, which we all know, surgical gloves, disposable eye gear, and then disposable shoe covers. All right. So the next few slides are how to access or how to administer first aid with bleeding or with broken bones. So these are a bunch of tables on how to handle these situations. So I'm going to go fairly quickly through them. I'm not going to read them all, but I do want to make sure that some of the terms that you hear a lot, I clear them up. So like for instance, the terms dressing and a bandage. Here's what they mean and how they work together. So a dressing is a clean material used directly on a wound to stop bleeding. So it can be a piece of gauze or any other clean piece of cloth. That is what you put directly on the wound. And then a bandage is a material used to protect or cover an injured body part. This bandage is a material used to protect or cover an injured body part, and that it may also be used to help keep pressure on a wound. So if necessary, you can hold gauze dressings in place over a wound with a bandage. Okay, so probably what's underneath there is the dressing, so like a piece of gauze to stop the bleeding, and then the bandage around it. So those are the differences. Okay. So again, these are a bunch of tables that will help you how to address these first aid scenarios. Most of the 3 steps are always the same. You want to make sure the scene is safe. What that means is you're not in the middle of the road with cars flying by, or you're not near a fire. You want to make sure the environment you're in is safe. If the person is caught in a car accident, you want to make sure you take them to a safer area. That's what it means when I say make sure the scene is safe. Then of course, if you have it, please wear gloves, wear as much PPE as you can. And then again, here are the steps to help someone with a nosebleed. And then here is how to help someone bleeding from the mouth. Again, these 2 steps are always the same. And then after that, you go and you get the first aid kit, right? So that's what you do with a nosebleed. And then this is what you do with someone bleeding from the mouth. Teeth and eyes. Again, you want to make sure the scene is safe, the first aid kit, and then wear your PPE. Again, this is what you would do with a tooth injury. And then this is what you would do when it comes to an eye injury. So again, I will give you a copy of this presentation so you can thoroughly read through it. I just don't want to, because I have 1 minute left, I want to make sure that I explain how these tables work. All right, and then if someone has a toxic eye injury, again, the first 3 steps are the same when it comes to these actions. And then first aid with bones. Again, you were just trying to help until the medical personnel comes. So these are the things that you can do until they get here. Not asking for you to be the doctor, be the nurse. Just these are the things that can help this person right away. So that is what you do for a person with broken bones, and then this is how to apply a splint. And then with burns, I know there's a lot of confusion. I've heard put mustard, put ice, put it under running water, there's a bunch of things, bunch of home remedies. This is what the American Heart Association says how to properly take care of any of these things that I'm saying with the teeth, the broken bones. This is with burns. And then for larger burns, maybe this person was caught in a fire. This is where that blanket would come into play. So I'm going to share this really quick video, and then we're going to recap, and then we are done. Let me make sure that I share my there we go.
There are moments in life we wish we could freeze in time. We live them. We live for them. They are intimately personal. They're gladly shared. What is life if we cannot experience these moments of joy, wonder, and happiness? We want people to experience more of life's precious moments. To do that, we must be healthy in heart and mind. For the heart is where life's moments are felt most, and the mind is where these moments become memories and are relived again and again. It's why we've made better heart and brain health our mission, and together we've made an extraordinary impact. Healthier adults, more active children, stronger survivors. But we are just beginning. Until there's a world free of heart disease and stroke, we'll be there, making a healthier, longer life possible for everyone. You may ask, why do we do what we do? The answer is simple. Because we are the American Heart Association and the American Stroke Association. And life is why.
That I always get a little teary-eyed with that video. But yes, the American Heart Association and the American Stroke Association is where I got a lot of my information from. And that is where you can go for further assistance. Maybe you do want to become CPR certified. Oh no, not again. Or maybe you just want to get more information. So with my final thoughts is, again, first aid can be initiated by anyone in any situation. Again, if you want to be certified, you can go ahead and do it, but first aid is something that you can initiate. You can do by yourself. You don't have to sit and wait for somebody else to do it. Communicate with your family and always have a plan. It's perfect to actually just print this presentation out and talk about it with your family. Hey, in case this happens, this is how we act. I know it can be scary when it's happening, but the better equipped you are, the better you can handle the situation. And then you can save a life, reduce suffering, and prevent further illness or injury, as well as help someone with an illness. So these actions that you take can really help someone's chances of surviving, or the wound or whatever, reduce suffering. You can really do it if you know how to act proper, as fast as you can. Okay, so I know I spoke the whole time. I didn't even get a chance to ask if anyone had any questions, but I know that this is a lot of content. So if you have any questions or any comments at all, please feel free to send Health Educator an email that is accessed by me and my program team. So we would be happy to answer anything else that you may have. If you want recommendations on how you can get CPR certified, I know someone that does it. You can also, if you have any other questions about the slides that I will provide to you after this presentation, please feel free to ask away. And I did put the survey in our chat, but here is the link to it. You can also take a picture of this code, the QR code, and that'll take you straight there. We are doing the raffle, so for every survey entry that you put, you will be put into a raffle to win a prize. So go ahead, it takes just less than a minute, and we really appreciate the feedback because that helps us get stronger and better with the content that we give to you guys. And then here are some of the upcoming events. We have resiliency tomorrow, we have immunizations and positive thinking next week, and then we do also have sessions in Spanish. So feel free to tell a loved one or someone if they also want to know more about communication in Spanish. Now, I will go back to this in case you need to scan that really quickly. But if you have any questions, I'll open up the chat. I'll start the video I'll start the video. Does anyone have any questions? Because if not, that concludes today's presentation. I know that I went 6 minutes over, so thank you for sticking in there. I'll stay for a couple more minutes if anyone else has any other questions. Thank you again for your time.